93 WIBC. All right, news that the FDA approved the first pill to help prevent HIV is making headlines. Truvada is something that a lot of folks are talking about, including Lisa Terry, who is the executive director of the Fort Wayne AIDS Task Force.
We have over 400 clients that we serve here in Northeast Indiana who live long lives, and they have a fine quality of life these days, as long as they do what they need to do. And that is that our clients need to keep their medical appointments and take care of themselves and eat healthy diets and also, take their daily meds and continue to use prevention. Our biggest fear right now is that someone out there hears the word Truvada and that it's some kind of a cure for HIV/AIDS when indeed it really isn't a cure. Will it add to providing HIV therapy? Yes. We know that it's very expensive. It can be as much as $45 a pill and can cost in excess of $14,000 a year. But this drug is specific to those couples, male and female or men-to-men couples, who are seriously monogamous, meaning that you can, by taking Truvada, prevent the disease in perhaps the partner who is not infected with HIV/AIDS.
Well, a lot of folks are calling it the biggest step in years toward curbing the spread of HIV in the United States.
Well, I do believe that it is effective. In most studies, I've been told that there was a 75% effectiveness rate, and these were in couples who were most compliant. I would also say that you can't just take a pill, pop a pill, and think that you've got the solution to all of your risks within the HIV/AIDS arena, because also, without using condoms, you have the risk of contracting STDs. And so we just like folks to think that you need to do everything that you can to prevent the disease. You need to know the facts. You need to know the risks. You need to use a condom. Yes, if you are in a monogamous relationship, yes, you could probably take the drug. It will keep the disease from affecting the partner. But that's really all it does. It does not cure the disease. It's not something that will work for everyone, because there are some side effects like headache, diarrhea, nausea, vomiting, dizziness, and even perhaps a rash. And to be quite honest, because it is so new, many of our clients aren't even aware of Truvada. But again, with the expense, this is not a solution for everyone.
It seems like the scientific world, the researchers are very, very excited about this, where those who actually are in the trenches are just kind of holding back, reserving judgment on this.
Absolutely. Everything has outcomes, and I know that Truvada is something that really represents an important treatment option for physicians and patients, not even in Indiana or in Northeast Indiana, but around the world. And so access to anti-HIV medication is the key to the ability to combat this disease globally. So, you look at it from a global perspective, it may have a much better success rate. But here, as you say, in the trenches where we work with people, for those folks who just refuse to or have difficulty wearing condoms, then another approach is, of course, Truvada.
Again, we're speaking with Lisa Terry with Fort Wayne AIDS Task Force. Lisa, just recently, the FDA approved OraQuick tests so folks could test themselves at home.
But I would just say to you that 1 out of 12 tests that we do at the public health department that comes back negative is not negative. So if you have a 1 out of 12 incidence, what will you have with these at-home tests? You still need to have a test done at your public health department, at a doctor's office, at a clinic, at a hospital to make sure. And it's certainly a good way that if you feel that you are having symptoms, to find out early on if you may or may not have contracted the disease. But again, you need to get testing done by professionals.